Good afternoon. This is United Medical, ACO, and my name is Kemal Erkan. Today is April 8th, 2022, Friday. This is our weekly event. And today we have a special guest. I'd rather call her our superstar of Delaware, Senator Sarah Mcbride. How are you doing, Sarah?
I'm great. It's so wonderful to be back with you. I'm thrilled to be on.
Well, thank you. And thank you for being with us. And Sean Donegan, as always, he is also with me today. And we are going to cover a couple topics. We did have a couple of scheduling issues. Well, first I went to Turkey in the month of March. And then you were called into White House and we were kind of teasing you at the last Friday event. Well, let's make sure that she's in the White House, and then you were in the White House, I guess. So, and then here we are. And so, since the last time we were together, you work on a couple of different bills, and you are still working on about more than a couple of different bills. So let's not just say several different bills. But one of the main one is your paid family medical leave. We are going to discuss that, and I do want to also discuss, if you are okay with this, and I know you didn't run for the office for one specific topic, and you don't have a special agenda of the transgender issues. However, some issues are inevitable. So this is one of the things when you are the first in the history of the United States. So I guess this is going to go with you, and then you are going to be asked these questions. So we are going to have a couple of questions from that side. But before we go with that, I do want to ask Sean to give us a quick update on the COVID situation, and if you have any. And we are not going to do detailed one on that. We'll just actually kind of we'll do a summary so that we can spend more time with you, Sean.
Yeah, for sure. Yeah. So just a quick update on our COVID numbers. The numbers are staying consistently low as we saw the Omicron variant drop off recently. And as we approach further into spring and the summer months coming up, we're not really expecting any super surge in numbers to increase. Maybe when it gets towards the fall, it may be a higher concern, especially the winter months coming up. But just right now, it is consistently low. It has seemed to have plateaued with our vaccines as well. Number-wise, we are at 218 million of the U.S. citizens being fully vaccinated and about 98.5 million having received the booster. And Delaware numbers, like I said, are seeming to plateau with our vaccines. So they're each up around about 0.1% compared to last week's update.
Thank you, Sean. Sarah, you may remember from our last session, we still continue with the updates on weekly updates with the COVID and the vaccination and any type of COVID-related issues. And I believe it's really helping the society. Other than our patients, I know that Delawareans are also benefiting from it. So now we are going to start with our discussion on the paid family medical leave. And I know because of the timing of this, when we were going to have this session first time, you were going to actually bring this to the Senate, and then it was going to run to the House, and those things already kind of happened. So if you can kind of run this through and then see what happened since the last time we met, and then where we are right now, and then what's the timeline for this to go live. Oh, you're on mute.
Thank you. So you would think after 2 years, I would have remembered to go off mute, but thank you again to both you and Sean for having me on today. I so enjoyed our conversation before that focused predominantly on what you just brought up, which was the really centerpiece of my legislative agenda, which is Senate Bill 1, the Healthy Delaware Families Act, that would establish an up to 12-week paid family and medical leave insurance program here in Delaware for Delaware workers. This is a program that would provide partial wage replacement for Delaware workers who are out on leave to welcome a child into their family, to take care of their health through a serious health condition or to take care of a family member through a serious health condition. When we talked last, I had introduced what was the original version of Senate Bill 1 and was engaging in stakeholder conversations across the state with stakeholders ranging from workers and public health advocates and providers to, of course, the employer and business community. In that time, I engaged in about 200 hours of discussions and negotiations on the issue of paid family and medical leave, because this legislation would establish an important new program that at some point would touch almost every Delawarean, because these life events, welcoming a child into your family, a serious health condition, or a loved one with a serious health condition, at some point, practically all of us will face at least one of those life events, whether it's the joy of a child or the stress of a serious illness. So in the last year, we've engaged in about 200 hours of conversations, and I put forward what we call a substitute bill, which is basically taking the original bill and inserting in its place a new one that kept a lot of the original legislation, but also made meaningful compromises at the behest of different stakeholders, including small businesses and employers, to create a program that meets worker needs while easing our businesses into this new program. One of the big changes is that we tied the new law more closely to the Federal Family and Medical Leave Act, which provides many workers with up to 12 weeks of unpaid job protected leave. We made the requirements in this bill really reflect a lot of the same requirements in that legislation, so that there wasn't a duplication of law in a confusing way, and that businesses, many of whom are already abiding by the federal FMLA, wouldn't have to do a ton of things differently. But of course, what would be different is that when workers are out on leave, they would be able to access this wage replacement, which for so many workers is the difference between their ability to take care of their health or to take care of a loved one or to start a family. And I'm proud to say that the substitute legislation was endorsed by Governor Carney, who was a fierce champion of this legislation. In fact, it was one of the main bills that he highlighted as a priority for his administration in his State of the State address in January. And it's received support from organizations ranging from the AARP of Delaware to the Delaware Academy of Medicine to Christiana Care and Nemours hospitals. It's received the support of both Democrats and a number of Republicans in Delaware. And I'm hopeful that as the bill moves forward, it will receive bipartisan support in the House of Representatives. It already passed the state Senate this past week. It passed through committee in the House. And so soon it will come to the House floor for a vote there. And again, I'm hopeful that we can get broad bipartisan support in the House, and then eventually, of course, send it to Governor Carney for his signature, which he is excited to provide. And so once we pass it, then we'll start implementing.
So you mentioned some compromises. So what was the least favorite one that you had to kind of make?
That's a great question. Well, I don't know that I could pick one least favorite compromise that I had to make. I think every compromise is a little bit difficult, but that's governing, right? I mean, governing requires compromise. I could defend every component and the rationale behind every component in the original bill. But in the substitute, a couple of the changes where we increase the eligibility requirements. So you have to work for longer to be able to access the benefit. The covered relationships, we've restrained the covered relationships for family caregiving. So if a loved one is struggling through a serious health condition, what is your relationship to that loved one? That's more constrained than it was in the original bill. Now it's just parent, spouse, and child. We've not automatically included certain smaller businesses. Every other state that has this program, it's universal in that it automatically covers every business of every size. This would only apply to businesses over a certain size, depending on the aspect of the program, either 10 or 25 employees. And so those are some of the changes that we made that were particularly difficult. But I believe that it's important we get this across the finish line, that we get this benefit in the hands of as many Delawareans as possible. And as I said, governing requires compromise. And while it's not everything I want, it's a really meaningful bill that reflects both meaningful compromise and meaningful change for Delaware workers.
So we have to be solution oriented, right? So we have to make it work in a way. So then otherwise it will be forever to get them done. So how are the employers? You said there's the size limitation with the employers, over 10 employees, I guess. So how are the responses that you are getting from the employers? Do they see this as like more like a extra cost to them, or do they see that as a benefit? Like as an employer, I can tell you that we see this as a benefit that we can actually expand this to our employees. I do provide no cost short-term disability for my employees, and then something like this would be also beneficial for us to add. But I don't know how the other employers are responding to this.
Yeah, and I appreciate you saying that, because that's exactly right. And that's the reality of this program. There's certainly diversity of thought. Some employers are incredibly supportive and see it as exactly what you just described, which is a real benefit. That's employers ranging from incredibly small businesses like Design LLC, which just has a couple of employees, to medium-sized employers like Brouhaha, whose owner is incredibly excited and agrees with exactly what you just said, which is that this is really a cost-effective way to expand the benefits that they provide to their employees. To large employers, including, as I mentioned, entities like Christiana Care, who's the largest private employer in the state, who believe not only that this is a good public policy from a public health perspective, but that this policy is actually really necessary to help recruit and maintain the healthcare workforce of the future, because we know this benefit is so in demand. And if Delaware has this benefit, we're going to be able to be better positioned to attract more workers and to keep more workers in our state, including in healthcare. And of course, we know how challenging these times are right now in terms of worker shortages and worker recruitment. And so a lot of businesses truly do see this as a benefit. The state chamber, because of the compromises we made, is in a place where they are comfortable with the bill. And I believe as we implement this legislation, as both employers and employees are now able to see this benefit in action, the support is only going to grow. That's actually one of the reasons why in New Jersey and New York, where they've had this benefit for years, more than 70% of small businesses are supportive of their state's paid leave programs after having experienced their benefits. We know that once these programs are implemented, both employers and employees alike receive the benefit from them.
Sure. So from the employees' standpoint, who are the biggest supporters? The group that you mentioned, now this is going to be maybe initially limited to the wife, husband situation and the father and mother and the kids, right? The immediate family. But then it can always, that's a start, right? So we can always start from there and then improve. One question is, can it not be done at the employer level, so that employer can choose whether or not they can expand that to a larger
network of people? So that's a great question. And one of the things we do allow in this policy, in the legislation, is for employers to have more robust benefits through private options. So we create a state benefit, which is sort of the public option, which is a floor. And then we also empower employers to either offer these benefits through private options that are more expansive, and actually they can opt out of that portion of the state program that they offer, either in whole or in part, or they could provide auxiliary benefits on top of the state floor public option. So there are opportunities for employers to provide more robust benefits than what the state is offering here. This is just to ensure that there is a basic floor, sort of a safety net. But if employers do want to provide even better benefits, they're entitled to do so. And there are multiple options for them to be able to do so under this legislation.
Right. So now you said that it's already almost final or about to be final?
So it's on the verge of passage. So it already passed to the Senate. It passed the Senate 14-7. It has now, just this past week, passed through the House Health and Human Development Committee, on its way now to the House floor, which is essentially its last stop before it goes to the governor. And so I'm hopeful that the House will pass it soon. I'm confident about the House passing it. They are passionate about this, as is, like I said, Governor Carney, who's been a real champion of this legislation. So it's almost there. It's almost at the finish line, which is very exciting.
When did you say the House is going to vote on this? When is the voting for the House?
It's not totally set yet.
Okay.
But it's now through committee, so it could be soon. Obviously, the General Assembly is in through June 30th.
So now, once it's passed, then when is the go live then?
Sure. So, of course, I would love this benefit to exist already yesterday. But once it passes, the state does have to essentially create the program from scratch. So that takes some time. They've got to hire the staff. They've got to issue regulations to flesh things out in a bit more detail to provide the clarity for employers and the information for employers in as great detail as possible. And so we would pass the legislation, and it then would not actually go into full effect until 2025 and 2026. So the program is funded through a payroll deduction that would begin in 2025, and the benefits would be dispersed beginning in 2026. So a little ways off. And of course, I wish it was yesterday, but we've got to have time for everyone to prepare, including the state. So that's the timeline for implementation.
So anything that we can help you with this?
Well, I think to your point that you made earlier, you all see this as a benefit to you as an employer. And I think sharing that, there are a number of employers, including, for instance, like I said, Christiana Care, Nemours, have drafted letters in support of what is now called Senate Substitute 2 for Senate Bill 1, and emailed the legislature to say, we believe that this is a positive benefit for employers and employees alike, and we urge you to support this legislation. Number of folks are speaking up, and I think that's a great way. Obviously, what you're doing right now, having me on in these ongoing conversations we've had about this bill, educating folks in your networks, that's critical. But I think your voice really matters, and people, of course, respect you as a leader in this state. And so letting legislators know that you support this bill, I think, is an important component of getting it over the finish line.
Absolutely. I mean, other than United Medical and the groups that we own, we also provide services for more than 50 practices, in total more than maybe 1,200 employees in Delaware only. So it would be definitely beneficial for all practices. So, and the main thing is if we can actually help our employees because these times are, until you have one of these times, you are really not, you really don't understand how important to have these benefits, because everyone is going through these. Just lately, a couple of our employees, they did have some family emergencies. I went through, even with it, like not our human friends, but with like I lost my my dog, and just the time of it is incredible loss, and then going through that time, and then like prior to that, and this is if it's affordable, and if we can actually make this work, it has to start from somewhere. So if the way that I see, if someone's mother is going through trouble, and in our culture here, there are not many options, and any option is extremely expensive. So if someone can take some time off and support their family, and then not to worry about their job, I think that's extremely important. So, and if we are able to provide that for our employees, that would be huge for us. And Sarah, one of the things that we have for you is with the the overall healthcare and your perception or perspective of your healthcare, I'll actually maybe open that question, or maybe more like in the dialogue, like the way that we do these days, our patient care, our approach to patient care changed. So social determinant of health is helping us to understand what's happening with our patients. So even when we go through those, what we see is patients are struggling with different things. This can be like the food insecurity. This can be the depression that they are dealing with because they are lonely. This can be the transportation issues. So there are several different problems that they are going through, and this is contributing to their health issues. And if the healthcare provider doesn't understand these issues, then they really cannot help them. Now, as an employer, if I don't really help, if I don't understand what's happening in my employees' lives, then I cannot really work with them in a way that, or they cannot work with us in a way that this is just, it's not like you can separate it. But when you are here, you cannot think about your dying mom or dying partner or dying child. So it's not, we are all human and we all have feelings. And that's why I actually, when we wrote you first time last year, that helped me to understand the issue a little bit better. And then, like, if we can help everyone to be on board with this in a better way, that would make us happy. Now, our second topic, and I was going to call you, and then I didn't, because you are in meetings. So you are called into the White House, and then I thought maybe you were going to tell me no. Then I said, let's just be prepared. And then I just told you this 3 minutes before the meeting, and I apologize. Now, I apologize, but I really shouldn't, because, well, you are a great role model, not just for one group of people, but for anyone, any family, any parents. They would be proud of their kids to be in your position. And I said this to you last time as well, and I'm so glad that you are doing what you are doing. Now, when we have you on the show, on session, so it would be almost impossible not to talk about some issues that our transgender population is dealing. Now, when we ask you to be coming to the session again, at the same time, Leah Thomas news were coming up, and I can help and just take some interest in what's happening, because it's happening in our society and it's at UPenn and it's so close. And I said, you know what, maybe I'll talk to Sarah about it. So then the issue got bigger than what it was. So then I went to Turkey, and then I came back, and then it got even worse than what it was. Now, last week, first time I told Sean, sometimes they don't know what I'm going to do and what I'm going to talk about. So I have my preparation in my head, and then I just tell them maybe like 5-6 days before. And then Sean is really good with taking the idea and then just helping me and putting things together. So this issue with the transgender college athletes, from a healthcare provider standpoint, I feel like there's a responsibility from our side to bring the issue up, because, like, when I deal with social determinant of health, that makes me more responsible of being more sensitive to certain issues. But also, it does help me, or it does make me more responsible to understand certain issues better. Now, and I know you mentioned in several interviews that you have given that you didn't run for the office to just talk about transgender issues. Well, as I mentioned before, so when you are the first in the history of the United States, this is inevitable, and we are going to talk about it. And it's all up to you how much you want to get into it. But I have some questions, and I want to share some of the stuff that I learned that I didn't know. And in fact, we kind of went a little bit even to the next level. And we did a survey in our network, and this was on Tuesday. Well, I wasn't really proud of the results, but I'm going to share those with you. And then I just got all the, like we have about 175 answers, I believe. So I just want to have a dialogue with you to see if we can understand this issue a little bit better. And then we'll just leave it there. Now, first, just from, it's kind of like, and I also asked Sean to reach out to UD because this is happening at UPenn. And this is not just one athlete, it's affecting a lot of other people at the same time. So, and I asked him what do you do, and then he played, he was the quarterback for UD. And then he had a different perspective of this issue. And then he just got an answer yesterday what their position is, if they have any issues arise from this yet, or how they are dealing with. And I'm going to ask him in a minute. So while I was going through this, I had to do some reading and some documentaries that I had to watch, some news program that I had to kind of watch again. The NCAA had a report on this issue. And then I said, you know what, let me just go back and then see if I understand the transgender issue. And I didn't. Apparently, I did not know the issue. So apparently, my definition, my understanding was not the correct one. So the sex and the gender were two different things. And then not just myself, but many people that I talked to, they didn't understand that either. So can we just start from there and not going into too much, but then we'll go into the college sports. So now that's identifying gender and how it's different from the sex that we are born with, what it means so that we can be better educated for that.
Sure. So for the vast majority of the world's population, their gender identity matches essentially the sex that they were assigned at birth, right? And when you're born, people look at the infant's body and they say, okay, based on this anatomy that I can see, you're a boy, or based on this anatomy that I can see, you're a girl. But we know that there is a percentage of the population that have existed throughout time and memoriam across cultures for whom their gender identity differs from the sex that they were assigned at birth. We know that there is a very deep and consistent understanding of one's gender identity that materializes from the earliest moments a child can verbalize and communicate. And that for trans people, they have a gender identity that differs from their sex assigned at birth. And that the only acceptable medical, and frankly, for that matter, I think moral and cultural reaction to that has been articulated that people should be treated consistent with their gender identity. That you can't, that in short, you can't change the brain, but you can adjust how the world sees you. And that's what oftentimes transgender people do as they come out. They take steps to have the outer world see what is true for themselves in their mind and in their heart. So, you know, I think one, I would say whenever there's a political issue that's rooted in a single individual and hysteria and panic around a single individual, I think we should take a breath and go, is this a solution in search of a problem that we're actually trying to solve? When a hysteria is rooted around a single individual person, oftentimes that's overblown. And frankly, for that matter, a pretty clear signal that a political force is seeking to use it as a political football.
That's a really good point, because actually, when I was talking to my team, because I did have a little, in our leadership meeting on Wednesday, I asked our guys, our directors, and what their position on this issue is. And then one of the things that we were discussing, this is coming from, the highlight is on one person, and then we really cannot just make this whole And I was actually, I wasn't gonna, I didn't necessarily, we don't rehearse these things, and we are just talking just now mainly. Wasn't sure if I want to say this or not, but I don't know if the Leah situation did help. And then I don't know how she's dealing with this, and I'm sure she's getting a lot of pressure, but it didn't help the whole situation, in my opinion, I felt like. But now going into the sport itself, reading the NCAA.
Can I just quickly say something on the Leah point? Like, she's just a person living her life, pursuing her dreams and her passions. And like, I think, whether the example is, quote unquote helpful or hurtful in a political context, this is just a person who's trying to pursue their passions in college. And I think that one, there is physiological and biological diversity within every gender, right? Mm-hmm. Elena Deladon is much better at basketball than many, if not all, other cisgender girls. She's certainly better at basketball than I am as a trans person. There's diversity everywhere. And one of the things that I like to say is that trans people have been competing and playing consistent with our gender identities for years and losing, right? And yes, there are going to be trans people who win. There are going to be cis people who win. There are going to be trans people who lose, and there are going to be trans people who win. And I think just because there are examples of some trans people who win doesn't mean that trans people have some massive inherent advantage. And even if we're talking about advantage, if we're really trying to level the playing field, then why aren't we looking at legislation that seeks to ban tall girls from competing against short girls in basketball, or girls with certain cardiovascular capacity to compete against girls with worse cardiovascular capacity, mm-hmm. right? I mean, there's physiological and biological diversity everywhere. What you can have with a policy like this is you can have two identical girls in capacity and skill, one who's transgender and one who's not. And the only reason why the transgender girl can't participate is because she's transgender, not because she has an advantage, just because she's transgender. And when you take a broad stereotype about a group that is not actually the reality about that group, that's not based on individualized assessment, but rather a singular stereotype, you universalize that, and then you create a policy that then categorically forbids that group from doing something because of that stereotype being universalized. That is literally the definition of discrimination. And I think,
and I agree with that.
Oh, yeah. But I was wondering if because I think this is very helpful. I was actually wondering if I might have the ability to play a 3-minute video for you that I think really captures a story that is worth hearing on this topic.
Absolutely. So I can give you access to so you should be able to share right now.
I can, and I just think this is a really powerful example, is that these bills that try to ban trans people from athletic teams consistent with their gender identities, we're not just talking about college kids who are still like young people. We're talking about really young people. And I think this video helps to get past a singular image that people have of who trans people are and recognize that there's diversity among who trans people are. There's diversity in our skill, that we're talking about kids at the end of the day. Mm-hmm. And what you think a transgender person is like and who they actually might be are not necessarily the same thing.
Ever since I was a kid, I always had a passion to make the world a better place. I'm Rebecca. I'm 14 years old. I am a nerd. I love school. I read a lot, and yeah, I just loved a lot. because she's a girl. She belongs on the girls' team. To say, oh, you belong in every way throughout the day. We see you, you're a girl, this is your life, these are your friends. Oh, but not on the athletic field. It doesn't make any sense. I would worry about my friends and the other kids in my school because I know what it's like to have my gender questions, to have to be, to prove I'm a girl. And I don't want them to have to go through that because it's violating and embarrassing. When you don't understand something, it can be scary. And when we react out of fear, then we can do really harmful things. The only people who should be afraid of Rebecca are her little brothers, perhaps, because like any good big sister, she terrorizes them at times. My kid is just a kid. She wants to go to school, have fun with her friends, and play sports just like anybody else. Sports are something that I really like doing. I'm so much more than trans. That doesn't make me less of a girl. It doesn't make me less of a human either. I'm just me.
So I just think that that helps to really reinforce that fundamentally, we're talking about kids who just want to play with their friends. And when the government comes in and says, you can't play with your friends because of this stereotype that we have, this
is important. So just because like I'm looking at one of the messages that I got from one of my pediatricians, what she was saying, if the kids, they went through this before puberty, they may not have any choice, and she was not happy with the 4 questions. If I can just share this one with you, so then maybe I was going to go to the UD first, but then we can let's do the UD first, and then we'll come back to the survey. So then I'm going to hopefully she will be, because she was kind of asking me that why I didn't actually add this one more option. So the UD's position, maybe Sean is going to cover this for us, and then I'll go back to the survey right after this.
Sure. Yeah. So as Kemal had mentioned, I had reached out over the past 2 weeks and reaching out to the athletic department at University of Delaware. Having been an alum myself, former student athlete, I know how hectic it is over there in their office. I was actually very pleased to actually be able to get an official statement from them regarding this topic, because it is a rather controversial topic, and I think the fact that it is controversial shows you how important it is, and the fact that you shouldn't necessarily rush to a solution. And in order to arrive at the best optimal solution, you also need to understand and comprehend things in depth before just leaning, on an immediate thought or what your initial reaction may be. So I was able to reach out to the University of Delaware on their athletic department, and actually got in touch with Jordan Skolnick here, who is their Senior Associate Athletic Director for Development. And we actually had a couple of phone calls back and forth, and he was able to talk it over with the athletic department, and they were able to provide us with this statement, which kind of reflects what I think I kind of just said here at the beginning initially, which I'll just go ahead and read a little part of it for you here. But basically that the topic of transgender athletes competing is important to them, and the fact that they actually just recently hired on Dr. Chris Brown, who is going to spearhead their diversity, equity, and inclusion effort, and the fact that they want to work more on this topic before coming to an immediate statement leaning one way or the other. So I think that does reflect the fact that it is an important topic and should be taken very seriously, and that in order to reach the most optimal solution, you're going to want to fully understand different factors and kind of what maybe the short-term effects are and long-term effects, and not necessarily just on the athlete themselves, whether the athlete is trans or cisgender, but also on the other people that are involved. So your other teammates, your coaches, trainers, staff, and the entire athletic department for a university. And this particular example is relating to the University of Delaware, but obviously there are many other athletic organizations, as we just saw in that video. It doesn't necessarily have to pertain just to college athletes here, but we know that what's recently in the news is regarding the NCAA And that's kind of what's seeing the spotlight. But as you mentioned in that video, obviously there's levels of sports all the way through youth up until collegiate and professional. And kind of just a personal, with my experience at University of Delaware, I know how much time and effort our student athletes have to put in. You have your mandatory workouts in the morning, you'll have film sessions, practice, your mandatory study halls to make sure you're getting your work done on time. And I know that, we are student athletes, and the amount of dedication that we put in is sometimes, the outside public may not necessarily realize. They think, oh, they just practice an hour here and they have games on the weekends or something. But, it is a full-time commitment. It's almost like having a second full-time job. And, the ultimate goal here is to make it all worthwhile for athletes and everyone involved. So having the University of Delaware kind of put that statement out that they are looking into it further, and before they're ready to, necessarily take a stance one way or the other, they actually, I think it's very good they are hiring a professional here, the doctor, to actually, it's part of his main job is to actually look into items like this. So that's just what the University of Delaware and what I found through my research here.
I'll say I appreciate always thoughtful engagement on any issue. I mean, the reality is that trans students, even in college, have been playing on sports teams consistent with their gender identity for years. Just because a trans student wins. I mean, Leah Thomas doesn't even have the record. Katie Ledecky still has the record, right? Just because a trans student won doesn't mean that we need to be reevaluating all of these policies. And to be honest, whatever University of Delaware was doing before was probably the right policy. I don't think they need to reevaluate because of a hysteria and a panic.
I don't think they had any trans students, right, Sean?
They might not, well, that they know of, that they know.
Not that I'm aware of.
That they know of, but a lot of but as is evidenced, a lot of times you don't know who's trans. And my guess would be that the University of Delaware was their original policy was probably complying with the NCAA policy, which was reasonable, which was fine. Mm-hmm. And frankly, complying with Title IX, which since the Obama administration has been held to include trans students, and policies that categorically exclude trans people from educational programs consistent with their gender identity have been found both by the Obama administration, now the Biden administration, and by federal courts to be a violation of federal civil rights laws. There's another thing that because I want to talk about health here, because we talk a lot about the biological aspects of like competitiveness, but what we don't talk about, and what I think you probably wanted this topic to introduce too, is the public health, the social determinants of health, the impact that these policies, frankly, these conversations even have on the mental health of transgender people. That's one of the reasons why the American Medical Association has come out in opposition to policies that ban trans people from sports consistent with their gender identity, because they say that can actually have a negative impact on depression levels, on mental health, even on suicidality. And I'd just like to read a quick comment from the Utah Republican governor. So he cites a couple of different statistics and then says something. 75,000 high school kids participating in high school sports in the state of Utah. 4 transgender kids playing high school sports in Utah. 1 transgender student playing girls' sports teams. Playing on girls' sports teams. 86% of trans youth report suicidality. 56% of transgender youth have attempted suicide. 4 kids and only 1 of them playing girls' sports. This is still quoting from the Republican governor of Utah. That's what this is all about. 4 kids who aren't dominating or winning trophies or taking scholarships. 4 kids who are just trying to find some friends and feel like they're part of something. 4 kids trying to get through each day. Rarely has so much fear and anger been directed at so few. I don't understand what trans people are going through or why they feel the way they do, but I want them to live. And all the research shows that even a little acceptance and connection can reduce suicidality significantly. End of quote. So, beyond this question of sports, we're talking about whether trans people are able to have positive mental health, and in some cases, whether they will live?
Well, sir, I think since the initial discussion that you and we have to this time, I think these discussions are very helpful, and this survey is kind of like telling me, or at least that's the way that I read these things needs to be discussed more and more, because more people need more education. Because I personally was surprised with this result, because the yellow bar is the one where it says it should be banned, and then the alternative solution is the one that where I made that was my answer. I said, well, why don't we just make it where the men is the open category, and then female sport, that section is kind of protected, so then everyone can actually compete in the men's section, men category. So there's just one category, and that got the least answer. It was 17% out of 175 responses, 30 of them with 17%. No restriction was at 23%, 23.4. And then with the hormone level restriction, which is what we have today, that's at 18.2%. But for the reasons that we have, like 41% of, and this is a population that's more advanced than regular public, average people. Most of these people are providers, physicians. And if the situation is this, so we have to do more education. So, and I thought this would be a good opportunity for us to talk about these, because one is, and that's always going to be the point, no one should be pushed to stop living their lives and then going into depression, going into other things. And we have to kind of make sure that everyone is welcome. And while we are doing that, we have to make sure that everyone understands what they are going through and then what the environment is for that. And then we are preparing. So that's when we call the UD. That was our goal, to make sure that they also know what's happening, or we at least, we want to make sure that they have some plan in place. But hopefully we can do more education on this. And again, one of my doctors, that's what I was saying earlier, right after you play the video, the pediatrician, she was making a pretty clear separation of, okay, well, the puberty is important because those kids don't have any way of getting out of this. So this is a real situation, real issue. If you have a child who's going through this, how would you feel? That's how I ask this question. So if you have a child who has this problem, if we call it problem, who is going through this, then what would be your situation? So then the situation would be, well, you would be thinking differently. So anyone would have a different position. And that's why if I can help the discussion, and I can help your solution with the discussion that you have with our network, and I can also help my own network. So I'm so embarrassed to even share this. I was hoping that, it would be, the first one would be even more, but it's not. So, and I'm sure we'll have more follow-up discussion. I don't know if you want to say anything for closing.
Yeah, no, and I'm not shocked to see those numbers. I think there's a reason why the same people who have opposed marriage equality, the same people who have opposed non-discrimination protections and employment, the same people who wanted to ban trans people from bathrooms, they're now focusing on sports for the reason that this survey reflects, which is that initially a lot of people might go, okay, well, I didn't care about bathrooms, but this is a place where biology makes sense and is worthy of consideration. But what that doesn't reflect is actually the nuanced understanding of the full diversity within the trans community. And that when you make that stereotype, when you universalize a stereotype, and then create a policy that treats an entire protected class based on that stereotype, that never wears well in history. And so I would think even if you don't understand it, even if you might have an initial hesitation one way, remember, we're talking about really vulnerable people. We're talking about people for whom this means this is not just their passion, but this is also, if we were to ban trans people from sports consistent with their gender identity, it sends a message about who trans people are and how we should be treated throughout society. And that can have significant
we live in a country that accepts that our coexisting is important, and this is the most freedom that should be allowed, and we shouldn't have unnecessary restrictions. And this is the United States, so the freedom is the main thing for us. Now, Sarah, I do want to tell you this. So I love what you do, and we will always support you. Anytime you have a problem with anything, I want you to reach out to us, because we will be always supporting you. Thank you so much for being
Thank you so much for having me. Great talking with you.
I'm sure we'll have you again on the session. So